My name is Karima Bradley, and for my assessment affair topic, I chose to discuss Pics Disorder. Have you ever came across the My Strange Addiction television series? In these series, individuals are seen eating different things such as nails, drywall, or even dirt. This show documents some addictive behaviors that can be dangerous or even life-threatening. As I took a closer look, I realized that some people in this show may be experiencing pica. Pica is a compulsive eating disorder in which an individual eats one or more non-nutritive non-food substances. So like I said before, these substances can include many things, such as chalk, clay, paint chips, rock pebbles or wood chips, dirt, coins, hair, and maybe even large amounts of ice. Because there are no set assessment tests or laboratory tests for pica, it is important for a diagnosis to be made from clinical history of the patient. This may involve doing a complete medical evaluation of medical history and a physical exam. That may also include x-rays or blood work. It is also important to review eating habits and also evaluate for presence of other disorders. AutismSpeaks.org, very nice primary care assessment. This went over review of systems, past medical history, behavioral status, and a plan. An alternative assessment that may be used to assess pica is the Eating Disorders Inventory, also known as EDI. The EDI self-report questionnaire is widely used both in research and clinical settings to assess the symptoms and psychological features of eating disorders. The original version was created in 1983 by Garner, Onset, and Povey, but since then there has been two other revisions in 1991 and 2005. The latest revision, the ED3, has been significantly enhanced to provide scales and composites for measuring constructs that are more consistent with psychological domains identified as relevant to eating disorders by modern theories. The EDI-3 can be taken by paper and pencil and also administered online and scored online via PeriConnect. Different populations that have been studied with the EDI include adults, adolescents, college students, older adults, and women. The age range is from 13 to 53 years old, and the test time takes about 20 minutes. EDI has been translated into a number of different languages. The introductory kit for the EDI-3 can be purchased from Pari Inc. and many other different places that are listed on this slide. It can range from $246 to $300. This kit includes many different things, but each component can also be purchased separately. The EDI has 12 primary scales. Scoring for the EDI-3 uses a 0 to 4 point scoring system that improves the reliabilities of some scales and yields a wide range of scores. Scoring can either be done by hand or using a computer-based program. Normative information is provided for the following DSM-5 diagnostic: anorexia nervosa, binge eating, and bulimia nervosa, as well as eating disorders not otherwise specified. The EDI-3 demonstrates excellent reliability. Reliability scores range from 0.90 to 0.97 across the 4 diagnostic groups and the 3 normative groups. Cronbach alphas was 0.90 to 97, and the test retest was R equals 0.98. The validity from the EDI-3 revision yields adequate convergent and discriminant validity. One of my critiques is that this inventory is a bit expensive, but it does make the most sense to buy the entire package. Another critique of this inventory that was discussed by Garner and Meyerholtz is that sometimes self-report measures have disadvantages because they can be less accurate than interview methods. So they need to be supplemented by symptom frequency data derived by interview or symptom checklists that can be provided in the package that is offered.